Have you ever seen someone squatting and their knees cave in? Or an Olympic lifter who catches a heavy clean and their knees pop in to help them get out of the hole? The inward motion of your knees towards each other immediately is often referred to as knee valgus. And I can't tell you how many different thoughts and opinions of that movement pattern different people have. So I want to explain what knee valgus is, talk about why so many different people think it's dangerous, give my opinion on the matter, and then get some research and coaching experience behind it. So to start, what exactly is knee valgus? In the medical field, knee valgus is defined as the outward angulation of the distal tibia on the proximal femur. But what exactly does that even mean? Your tibia is your main shin bone. Make a fist, bring your shin up, knock on your shin, that's your tibia, boom. When your knees start to cave inward, this creates a position where the body of your tibia is angled towards the middle of your body at your knees, or slicing laterally or outwards. This angle right here, that's knee valgus. And when people start talking about the dangers of knee valgus, the number one injury they associate that with is tearing your ACL. ACL stands for anterior cruciate ligament, and it starts at the back side of the bottom part of your femur, which is the large bone that makes up your thigh, and then it goes to the top front part of your tibia, which is the guy we just made a fist and found. So if you're looking at the ACL and where it attaches to, it's not hard to understand that one of the main functions of the ACL is to stop your tibia from excessively moving forward during movements that you're bending your knees, like a squat. But before we go there, when talking about tearing your ACL, it happens in one of two different classifications: contact and non-contact injuries. For the point of this video, I'm hoping that you're not taking too much contact in general when you're in the gym, especially not when squatting. So we can narrow this conversation down to non-contact injuries. According to Bodeman and colleagues, most non-contact ACL injuries occur during some sort of lateral pivoting, landing, or decelerating during a sport. Which, if you think about that compared to a squat, it's a little bit different. Further on this topic, Crosshog et al. Found that most non-contact ACL injuries occur with your knee nearly fully extended or almost fully straight or locked out, which he defined as anywhere between 0 degrees and 30 degrees of knee flexion. And this is what 30 degrees of knee flexion looks like in a squat. Beyond 30 degrees of knee flexion, there are very few ACL tears reported. And if we look back at the first two examples from the beginning of this video, it's pretty clear that a lot of the knee valgus we see in strength sports occurs with a larger amount of knee flexion than 30 degrees. At this point, the ACL isn't contributing as much as it was earlier in the movement, and by the time you stand up out of the squat and get back to 30 degrees of knee flexion, most people's knees are back in plane. To dive even deeper, let's look at some evidence to understand why we might see some knee valgus at the bottom of a squat. Vygotsky and Bryanton in 2016 did a study that looked at different muscles that contributed to getting out of the bottom of a barbell back squat. And when looking at someone squatting to greater squat depth, which this paper defined as any depth greater than 30 degrees of knee flexion, that causes the adductor magnus to be the muscle that contributes the most or is the most activated while standing up out of the bottom of the squat. Okay, wait a second. I've heard of the glutes and quads, but what the heck is the adductor magnus? Your adductor magnus is a large muscle that runs on the inside of your thigh. Its main actions are to extend your hips, which is like standing up out of the bottom of a squat, and adduct your hips, which is like bringing your knees towards each other. Did you catch that? If this study found that the muscles that contribute the most to standing up out of a deep squat is your adductor magnus, and one of the main actions of the adductor magnus is to adduct your hips or bring your knees towards each other, then on top of that, we aren't very concerned with your ACL in the bottom of the squat, then what's the big deal with knee valgus? To me, some slight knee popping inward out of the bottom of the squat would mean that you're doing a great job of recruiting your adductor magnus, and it happened to cause your knees to come in a little bit as you're standing up. Now, does that mean I want everyone's knees to look like a baby giraffe every time they squat? No, and I didn't say that, and this is where context of the situation matters. The first question that you should ask is the movement that this person doing loaded or unloaded? For example, if you're squatting down to get something out of the cabinet in your kitchen and you have some knee valgus, it's really not that big of a deal. Because for the average person not in knee pain, your body weight is not a huge load that your body's having to deal with in that position. And most people's tissues are adapted to be able to tolerate that amount of stress. But when you start to add load, this is where what the person's tissues are adapted to handle really comes into play. For example, if you've been squatting for 10 years and you've had relatively the same knee movement throughout that whole time, it's not hard to understand that your body has probably adapted and gotten used to the knee position you're hitting when squatting. On the other hand, if you're a relatively new lifter, or you haven't allowed your body time or haven't progressed your training in an intelligent way so that it can adapt and get used to a certain position or movement, this is where you could increase your risk of injury. That being said, outside of this scenario, any position, not only knee valgus, could potentially get irritated if someone doesn't progress the movement correctly or isn't ready to handle a certain movement or load at that time. In general, you are a strong, adaptable person. Don't worry too much about it. Just be consistent with the activity that you're wanting to do and follow a program to progress it. So back to this whole topic of knee valgus. One way that you can look at it in a little bit more of an individualized approach is comparing a person's knee position during a bodyweight squat compared to a loaded barbell back squat. If it goes from no valgus to all of a sudden you have some knee valgus, or you had a little bit of knee valgus and now you even have more, that is where potentially tissue might not be ready to handle a certain amount of load in that new position that they haven't been adapted to. Then again, if they aren't having pain or their knees aren't irritated with the position, is it that big of a deal? And this is where I think using your critical thinking ability and your past experiences on an individual level for each person can really help you out. If you have a relatively new lifter and every time they go to squat, they're all wobbly and all over the place and don't do a very good job of staying in control, especially if they're loaded, this is where I shift the conversation to a performance-based approach. If your knees are caving in on the way down, especially from the beginning of the squat, I don't think it's too crazy of an argument to say that your performance in the squat might improve if you could use cues and correct loading to help keep everything locked more into plane. Someone not being able to control the movement of their knees due to not having the strength or skill of a certain movement is different than someone maximizing their adductor magnus contraction and having their knees pop inward out of the hole. In general, you need to look at yourself or the person in front of you and decide if it's really something you need to worry about. With the injury rate in powerlifting being about 2.8 injuries per 1,000 hours, and weightlifting being about 3.3 injuries per 1,000 hours of doing that activity, both these sports are relatively safe when compared to another sport, such as men's NCAA basketball, with an injury rate of about 8.5 injuries per 1,000 hours. On top of that, Calhoun did a study and looked at frequencies of injuries per body part in elite competitive weightlifters, and found that about 85% of all knee injuries for weightlifters are tendinopathies, and 6.5% of them are strains, which leaves any other injury to happen only 8.5% of the time, which gives us another argument towards the is knee valgus that big of a deal side. Let's say that you decide knee valgus is affecting your performance or the knee position is causing some irritation. How do you fix it? I would start by not freaking out. Let's treat this just like any other technique change. The first cue that I would try is just to think about pushing your knees out more, especially on the way down. This can help, it's sometimes that easy. If that doesn't seem to help, the next thing that I would do is to decrease the weight on the bar and add a tempo to your squat. What this does is forces you to decrease the weight on the bar, which for some people, a certain load could be the reason for this issue. All that means is that your body isn't ready to lift a certain weight in that position yet. It's okay, it sometimes takes time. The second thing adding tempo to your program does is really makes the person doing it learn the movement. And it does that by increasing the total time under tension or the amount of time you spent squatting. For example, if you do 10 squats that take 1 second each, that set had 10 seconds of time under tension, versus doing 10 squats that are slowed down and take 3 seconds each. That's 30 seconds of time under tension. Not only are there hypertrophy benefits from increasing your total time under tension, but spending more time doing the specific activity that you're trying to get better at can definitely help too. Not to mention, it forces a new lifter to spend time controlling and learning a new movement. From there, just slowly progress your training in some aspect until you feel comfortable with how your knee position is during the squat. Knee valgus can seem like a very scary thing from the outside looking in. But after all of this, I hope you can see that there's no perfect way to move. And we just have to take this one situation at a time and not make bold statements that makes everyone think a certain movement is bad.